Greetings, everyone, and welcome to this Asia Pacific launch event of the Together We Can report on the COVID-19 impact on stateless people. The report itself was launched last week and is now available on the website of the Institute on Statelessness and Inclusion, as well as a number of our partner organizations. My name is Amal Dichikera, and I'm the co-director of ISI, and I will be moderating this panel, which brings together a set of fantastic and exciting speakers from around the Asia Pacific region, members of the COVID-19 Consortium, the director of our strategic partner in the Asia Pacific region, Nationality for All, as well as a number of expert voices from the UN, donor, and human rights worlds. The report that we launched last week focuses on the COVID-19 impact on stateless people, and it also puts forward a roadmap for change. And this report has been pulled together by organizations that have been working in 13 countries around the world, a set of NGOs, grassroots activists, stateless people themselves, who have come together to form a consortium in order to respond what we have seen as the exacerbating impact that COVID-19 has had on the denial of rights of stateless people. The reason we came together was actually because, as a consortium, was actually because one of our panelists, Deepthi Gurum, got in touch with the ISI team early on in the pandemic days to inform us that there were a number of stateless families in Nepal who were being excluded from government relief simply because they could not present their citizenship cards. They did not have a citizenship card in order to access this relief. And this was the first of a number of different distress calls that we received from partners around the world about the way in which lack of documentation, lack of legal status, denial of nationality rights was resulting in stateless people having an even more difficult time when everyone in the world was having a very difficult time in the context of COVID-19. And we see this same trend continuing today, even as we are talking about global vaccine rollouts, which is one of the focal points of today's webinar. And so I am delighted to be with you all to talk about some of the important issues that come out of this report, particularly focusing on vaccinations and focusing on legal documentation and the way these two issues tend to play together, and the way stateless people are denied access to rights, healthcare, vaccinations, because they don't have legal documentation, because they don't have a legal status. I will not take up too much time because we have many panelists who have a lot of expertise to share. And instead, I would like to get straight into it. What I would like to do before handing the floor to the first speaker is to remind all viewers that if you do wish to raise a question with one of the panelists, please do drop in a question by using the Q&A function, which is at the bottom of your Zoom screen. And we will try and get through as many questions as we can towards the end of the session. If your question is directed to a particular panelist, please state their name. If not, I will use my discretion and share the question and direct it to some or all of the panelists. Now, our first speaker is Khalid Hussein, who is a lawyer and activist from Bangladesh. He's a good friend of ISI's, and indeed he's been a member of the COVID-19 Consortium. He is the chief executive of the Council of Minorities, and he's a member of the Urdu-speaking community of Bangladesh. He grew up himself in the Geneva camp in Bangladesh, and he has been the face of landmark cases that have been brought before the Bangladeshi Supreme Court, which have challenged the statelessness of this community and which have resulted in the community being recognized as Bangladeshi citizens. They still continue to face immense challenges in terms of documentation, and Khalid has been at the forefront of working to serve his community and ensure that in times of COVID-19, they still have access to the healthcare, to the relief that they are required to have access to, and indeed that they have access to vaccinations. Khalid, it's my pleasure to hand the floor over to you.
Thank you, Amal, and thank you, everybody. As Amal said, I am I'm Bihari, Urdu-speaking linguistic minority and formerly a stateless person. Before 2003, we treated as a stateless because we born in the camp, and camp is designated as a standard Pakistani camp. So the background of the Biharis is we migrated from different part of India in 1947 and 65, and after that in 1971, the Bangladesh has been emerged as an independent country, and then we Urdu-speaking people, those migrated from different part of India, we become the stateless, and Pakistan denied to accept this community. Bangladesh denied to give us the citizenship. So as Amal said, I grew up in Geneva camp. So when we grow up, we decided we are living in the refugee camp, but we are the Bangladeshi, but no one is recognizing as a citizen. Then the first time in 2003, including me and my other friends, we 10 petitioner from camps, we filed a petition in High Court, and then the first time the High Court said this by bond Bangladeshis are living in the camp and they are Bangladeshi citizens. And after that, then again in 2008, we filed another petition and we claim ourselves, those are living in 116 camps, they all are Bangladeshi citizens, but their name is missing in the voter list. So 2008 court judgment allow us to claim ourselves as a Bangladeshi citizen and enroll our name in the voter list. So still the people are living in the camp. That means we are Bangladeshi citizens. We change our legal status, but our basic rights are not fulfilled by the government. So people are living in the camp, so they are facing so many discriminations regarding the civil documentation, the government jobs, government reliefs, and all those things. Why we started these projects like the COVID-19 impact on the minority of Bangladesh in the global pandemic in this consortium. We just faced in the first lockdown in 2020 when the Bangladesh allowed the lockdown, and we all the people those are living in the camp, they are normally involved in the informal sector. They are rickshaw puller, barber, butcher, handicraft worker. They all stuck and they don't have any access, to go out to earn the money for their families. So on that time, the government and some agencies they just provided the relief, but they didn't provided any relief work inside the camp. So because of the camp people, because of the Bihari, they are living in the camp. So we realized really we are marginalized, and within this period we are more marginalized in the COVID situation. Then we talked with the ISI team and all those teams. So we decided we will start a COVID-19 impact project in the camp, and we will establish at least 10 human rights defenders. Those defenders will be trained as a pandemic issues, and they will work as a bridge between the community and the government. So in November 2020, we started this project and we trained 10 community defenders, and now defenders are working inside the camp. The first time the camp dwellers are come to know about the COVID message, the accurate message. The camps are very density, the 10 feet to 10 feet house in the camp. So social distancing issue during the pandemic is impossible. So no one is bothering wearing the mask or washing the hand or maintaining the social distance. But when we started this project, our defenders they started the outreach, daily outreach to door, and they are disseminating the message of protection uh, of the COVID-19 situation. How you have to wash your hands when you go outside the camp. You have to wear the mask. If you are feeling some symptoms, you have to separate from your family, and you just call us, and then we will be able to show you the doctor, or we will be give you the advice to go to the doctor. So every day this type of message. So far, the first time in the camp people receive 24,970 people reach within this COVID messages. Like within this, the female 11,290 female we just reached to the female in the camp, and 13,680 female they come to know about the proper knowledge, proper message of the COVID-19 situation. And among this, we started, the community group meeting. We believe we are reaching the outreach situation in the camp, but some important message are so important to give them the clearly. So our defender invite the community mixed group like men, women, boys, and girls, and they disseminate the message of COVID-19 situation and the relief work, how you will get the relief from the government or the city corporation. So far we have conducted 50 group meetings, and we have covered 750 community people in Mohammadpur, Mirpur, Khulna, in Mohammadpur, Mirpur, Chittagong, and more places. So this was really appreciated work when we started this work. Some government officials, they appreciated really this is a good time to learn the community people, because these are the very rich situation, and the local community, the local people, they assume the camps are more vulnerable than the other part, because the camp people are living in crowded places, so they are the carrier of the COVID-19. So the work is important to work inside the camp to learn the people. In the meantime, we face so many challenges regarding the civil documentation issue. We have the paralegal program supported by the Namati, and we have 15 paralegal. They all stuck during the lockdown, and still we have a very less activities in the field. Why? Because the government office has been closed, and they have the limited access to provide some documentation issues. And when our paralegals, our defenders are going to the city corporation office, they are completely denying. They say, no, we have very short time, like 2 hours or 3 hours. So we have so many clients. We have to deal with this. You guys are living in the camp, so we are not gonna to work. If you submit your application, you come 3 days ago, 4 days ago. So normal people are getting the service within a short time, but the camp dealers are getting the support within a 7 days or 9 days or 10 days. So within this, we are trying to work more and more. We are engaging some of our pro bono right defenders and pro bono paralegals. They are also helping to the paralegals, the paid paralegals, and the paid defenders. So in the meantime, we started some good work like vaccination in February 2021. The Bangladesh government first time launched the vaccination, and the vaccination process was so difficult for the camp dealers, because they have to go through with the online registration, and they have to get the appointment, and then they have to visit the government office. So the camp dealers was very much worried about this vaccination. So our right defenders under this project, we started the online registration. Our right defenders, they visited with the mobile and internet support, and they registered their name. So far, 42 camp dwellers are successfully, they received the 2 dose vaccination. Unfortunately, when we started after that, the vaccination activities has been closed because we have the shortage of the vaccination. So now it is stopped, but our right defenders are, they are trying to list the name of the people those are interested to get the vaccination. So once we have completed the list, and when the government will start it, the reopen the registration, we will go through just the registration of the vaccination. So now the defenders are doing the outreach, and they are disseminating the message, and moreover they are doing the registration work, because so many people are interested in the camp to register their name for the vaccination. So we have a bunch of lists of the camp dealers. They are just waiting. Once the government will start, then the defenders will start the registration issue. So these are the challenges we are facing, because the Biharis are a very sensitive minority in Bangladesh. So everywhere in every places, the government, they do the politics behind the shadow. They say, yes, you are Bangladeshi citizen, you have national ID card, but in terms of the service providing, this they completely ignored. Like if I submit my application for the birth registration, they will take 7 days or 8 days. But for the others, okay, within the 2 days or 3 days. Nowadays, they have very short period of working time. They are just denying, oh, you are from the camp. So very easily they can identify our defendants and the paralegals because of the address, about the client. When the application show, oh, there is the camp address, okay, your application will start from next week. So these are challenges we are facing. So in the meantime, what we are trying, because it's almost 2 years and our civil documentation activities are completely hampered. So we need more and more workforce. So we have started some workshop and empowering our women group and community youth. So our paralegals and defenders are disseminating and the learning to the women group and the youth group what they are doing, like city corporation work, fill in the application. So we have a group of pro bono youth. They are ready to apply for the birth certificate issues or the civil documentation issues. Our women are ready. So once the situation will be very easy for everybody, then our workforce will be more, and then we will try to complete the civil documentation issues for all the camp dealers. Those are really required. Those are need in the camps.
Thank you so much, Khalid, for
Thank
that very kind of rich account of the really important work that you and your organization and your group of fantastic volunteers are doing in Bangladesh. And if you do read the report and look at the Bangladesh chapter, you will actually see some of the fantastic impact that is being made through this community-based approach, where people who otherwise would not have received vaccinations have received vaccinations because they've been accompanied by paralegals, and they've had people who understand how to navigate bureaucracies to help them to do so and to access vaccinations. I think the example of the Bangladesh work shows two things. One is it shows that statelessness isn't necessarily resolved just because there is a change to the law or a strong judgment which declares that a particular group is no longer stateless or should be regarded as citizens. This is indeed our experience in the context of gender discriminatory nationality laws as well, where law and policy change alone does not change practices. And the work continues to ensure that people who have been impacted by statelessness for decades, they are able to access their rights on equal terms as their fellow citizens. I think the other really important takeaway from the Bangladesh example is, of course, the importance of the community-based approach. And this is one of the reasons, actually, that our joint report, our consortium report, is named the Together We Can report, because we truly believe that together we can make a difference. And it is up to us as a global community, as a regional community, and as communities grounded in their own societies to come together to look out for each other and to make the change that we believe is necessary. And on that note, I would love to welcome our second panelist, Deepthi Gurung, who really encapsulates this idea of community, the idea of perseverance and resilience. Deepthi is a fantastic, strong women's rights activist who has been campaigning for equal nationality rights in Nepal, a country, one of the 25 countries in the world which still denies women equal rights to pass on their citizenship to their children. And Deepthi has been at the forefront of community organizing, and indeed has been one of the leading actors in our COVID-19 consortium. Like Khalid's work, Deepthi's work in Nepal has also taken very much a community-based approach. And it's my pleasure, Deepthi, to give you the floor to share with our participants your own experiences. Thank you.
Namaste, and thank you, Amalji, for this platform. I'd like to start by saying, first, my namaste to all of the participants, the attendees here on behalf of CAPN members, that's Citizenship Affected Peoples Network. We established this network long time before this COVID crisis happened, and we had been doing a lot of campaigns and a lot of activities with the help of other organizations around us. So here today we are gathered to share our experiences, learnings, and challenges during this pandemic, and what we've been specifically, what it has been specifically to the stateless community, so that we could do something about it. So it is our honor to work with the human rights defenders from all over the world with an unprecedented initiative from Team ISI, who have dedicatedly worked for this stateless people from all over the world. Through the report, we have tried to share the situation that is faced by the stateless people in Nepal. First, let's talk a little bit about humanitarian part. Though we were able to do a small humanitarian relief distribution in the beginning with the help of ISI team again, it is very difficult to continue this as the mobility itself is restricted now, and we are still in the state of lockdown. But even now, we are getting a lot of cry for help from so many places from all over Nepal, which we still have not been able to do it as much as we wanted to. We always wanted to do. The difficulties that are stopping us to do are, the first is the lack of fund in this huge scale of relief fund. As we say, while we are talking, there's still 6.4 estimated people who are stateless, million stateless people in Nepal. So a relief project of that huge scale still is not possible, but whatever we can from our side, we're still trying to do it. Second, the lack of manpower due to limited mobility. Because the lockdown has been imposed, it has been difficult to bring together manpower physically to affected areas and conduct any relief projects. People in health institutions, police, or help like similar kind of institutes has been conducting such rescue operations in limited guidelines, and other are basically not allowed to conduct such acts so far until you or your own family member have medical emergency. One is not allowed to leave home. So or these would be stopped, or else we would be stopped, detained for a few hours, or punished. I myself have been caught by the police, city police, several times while in emergency situation of my family relatives. Second, the lobbying part. Mm, Here too, due to the pandemic, the issue has been pushed further away for sanctioning the act. Um, in fact, it is a bit more worrisome that we might lose what we have achieved so far, rather than gaining more achievements. The opponents are getting more time to weave more lies and fears among people, have become more manipulative, giving more psychological treatment in social media throughout this pandemic. And now the new thing has come is ordinance. Through ordinance, there have, it seems, very progressive and very, it'll look like, stateless people will immediately get citizenship through that ordinance or something like that. But it is so not true. It seems that government was trying to help the situation, but in our opinion, this move has harmed more than it has helped. How? Simply because the ordinance is quite weak and loose step to begin with, and now it has been stopped by the Court's stay order, the recent progress. Rather than bringing such whimsical moves, if government would be serious on this issue, then it would have been much greater effort in bringing the act itself. Hence, I say this has harmed more than it has helped. And third, the mental health issue. Large number of stateless people are going through mental health issues currently. Frankly speaking, among those large numbers, many people would absolutely be cured with one medicine, and that would have been far more effective than any other medication, which is providing citizenship to them. Having said so, though we are fighting against the wave in every moment of our lives, the immediate mental health attention is needed so that the long-term damages can be avoided. So that is for this reason, we have been trying to address this as much as possible through telephones, through social media, and through group discussions, and so on and so forth. The fourth, the documentation during the pandemic. This part is even more painful, as we can see with our own eyes how stateless people are taunted and pressured and stopped from accessing relief materials, vaccination, treatment in the hospitals, etc. Though the law in paper has been issued that people without citizenship can avail all the state facilities during the pandemic, but in reality, it has been a huge challenge for stateless people to overcome this barrier. So hence, I'd like to come up with few of the things that this pandemic has pushed us in our head so far. So I urge that through this global movement, we have to draw attention of international parties again, very strongly, I vouch for. I hope we can create that the needed push from international parties can be created, such as to the UN or similar organization, to pressurize the local government and be serious in solving the issue for long run. Also, I'd like to end up by urging this team that let us focus in highlighting the issue as a human right issue in the world against those who are making this a political issue for their own selfish gains. Thank you very much. Have I been on time?
You've been well on time. Thank you so much, Deepthi. You were so well on time, I wasn't ready to unmute my mic. Thank you for that really constructive intervention, which looked at some of the main barriers to change, and which I can say as someone who's had a kind of a helicopter view of issues around the world, resonates with the situation in countries, not just in the Asia Pacific region, but globally, and which really shows that we are dealing with an issue which has a massive structural impact on people's lives. And it's an issue which is caused by deep set discriminatory arbitrary laws, policies, and practices. And like you mentioned, there's no quick fix. The fix has to be thoughtful, it has to be sustainable, and it has to be grounded in law and policy change, as well as in engaging people's minds to convince people to think differently about a certain segment of society. Thank you for raising the mental health impact of COVID-19. I know this has been an issue that's been very close to your heart. And indeed, this is an issue, this is one of the consequences of our failure as society to look out for our own and to do so in a principled human rights-based manner, as you mentioned. Uh, many of the issues that Deepti spoke about are articulated in our report. And before introducing the next speaker, I'd like to take a couple of minutes just to talk you through the report itself and what you would find there if you've not had a chance to already look through it yourself. So the report is structured in three parts. The first part obviously provides an introduction and a summary and overview, but it also provides shares a roadmap for change, because we do believe that COVID-19, whilst it has made things incredibly difficult for stateless people, by doing so, it has also shed a spotlight on the injustice of statelessness. And it has brought the issue to attention of people, institutions, governments, individual experts as well, who were not necessarily previously aware of the statelessness, the consequences and impact of statelessness. We then go on in the report to look at some of the comparative issues that have come out globally on statelessness, and we group these into 5 different themes. We look at the right to nationality and documentation and legal status. We look at equality and non-discrimination. We then look at the right to health, and with a particular focus on access to vaccinations. And then we look at other socioeconomic rights and other civil and political rights. And then in part 3 of the report, we kind of spotlight the 13 countries, as well as some regional situations and the situation of the Rohingya refugees who you will find in a number of countries in the region. And this part is really very much grounded on the experience of our different consortium members. So if you were to look at the Nepal chapter in the report, for example, you would learn more about the fantastic work that Deepti and our organization are doing. And you'd also learn about the statelessness issue in Nepal from the perspective of Deepti's group. Similarly, in Bangladesh, you would learn about Khalid's group, and we like that we have a number of countries, most of which are actually in the Asia Pacific region. It's my absolute pleasure to introduce our next speaker, Subin Mulmi. I first met Subin a number of years ago when he was a very promising young lawyer with a Nepali NGO, one of the leading Nepali NGOs on human rights and women's rights in particular, called the Forum for Women, Law and Development. Subin since went on his own travels. He toured the world. He did his master's, and now we're very happy to have him back in the statelessness and nationality rights field as the executive director of Nationality for All, who are our strategic partners in the Asia Pacific region, and of course, our co-hosts of this webinar. So Subin, you've been an insider-outsider, I guess, on this process. You haven't been directly involved in the consortium projects, but a number of NFA's partners have been directly involved. And you've seen the outputs of their work. You've obviously seen the report and commented on it and helped us to craft it. So I'd be very intrigued to hear your insights, obviously also with a focus on access to vaccinations. The floor is yours.
Thank you very much, Amal. And thank you, ISI and the COVID-19 Consortium for preparing this important report. And again, thank you so much for making NFA a part of this Asia Pacific launch event as well. And like you mentioned, Amal, having gone through the report in detail, I can safely say that the roadmaps and the calls to actions that have been laid out in the report provide a really strong framework for all the stakeholders, not just to strategically plan their activities to address statelessness, but also to learn and, more importantly, unlearn about the complexities of statelessness in general. Firstly, I think I want to echo what Khalid and Deepti ji just shared with us. I mean, there's so much to learn from Khalid and the Council of Minorities' work in Bangladesh. And I think you rightly highlighted the impact of the community-based approaches through the paralegals in Bangladesh. That is, I think that's a lesson to learn for so many other organizations working in the grassroots as well. And I think Deepti ji also rightly highlighted that in these times of the pandemic, there's obviously this importance to keep fighting and sort of keep grappling, but also preserve the achievements of the past, which have been under threat because of different political upheavals that have presented in many countries as well during the pandemic. For today, I just want to focus on two different lessons of the pandemic and in the context of statelessness. The first one is the need to listen more to the persons with lived experiences, and the second one is the need for vaccine equity, which I'll be talking about in detail. I think the first lesson, which is the need to adopt this more bottom-up participatory approach to addressing statelessness, that particular lesson, I think, is perfectly embodied by the three-step roadmap of the report, which I believe is even more relevant to the Asia-Pacific region. I don't need to reassert the gravity and the scale of statelessness in the region. The two speakers have already done that. And I'm sure all of us are aware that this is the region home to the greatest number of persons affected by statelessness. And this is also such a diverse region. And because of the extreme diversity of this, there are risks of, when we're coming up with these roadmaps for the report, there's always the risk of reducing and oversimplifying the diverse lived experiences. And I think this is where the report has, done amazingly to sort of focus not just on the specific challenges of these countries, but also, a lot of thought and effort has been put, I think, to come up with these three roadmaps that perfectly encapsulates the impact of COVID-19 on stateless persons. And I just want to dive a little deeper on the first step, which is checking the institutional blind spots, which is the first step of the roadmap. And especially not just in terms of statelessness, but in the entire human rights regime as a whole. Because COVID-19 has given an opportunity for all of us, including NFA, ISI, for all of us to pause, think, and reflect. Specifically in terms of statelessness, the ordeal has sort of highlighted the importance of thinking through our past actions, addressing the historic failures, strategies that we've undertaken, and the partnerships that we have forged. For example, specifically talking about the Rohingya population, it has shown that there is a need to think beyond documentation. It's not always about nationality. It's not always about citizenship and addressing the de facto statelessness. It is about beyond that. It is about universal healthcare. It is about preserving culture as well. It is about vaccination. So I guess it is imperative for all of us to participate in careful introspection. The second step, which talks about including, consulting, and engaging in dialogue, rightly highlights the need to sort of go beyond the tokenistic participation of affected persons. And I'm so glad that today we have Khalid and Deepti as speakers, as part of the consortium team, as researchers, as in their capacity as researchers, where they are able to study about their own lives and also talk about their own lives themselves in a direct manner. And they're not sort of always, I guess there's been this tendency where persons with lived experiences sort of use their emotional labor to educate us. And I'm so glad that this particular launch event and the entire process of preparing this report has been such a welcome change. And this brings me to the third step of building back better. And I like to mention, this is an opportunity. This is an opportunity to also unlearn and deconstruct the existing institutions of the human rights system. A system that can do so much more in terms of amplifying the voices of the stateless persons. And this can be done by ensuring that stateless persons in power, or certain persons in power, and this includes organizations like NFA, that we do not occupy spaces or even take spaces that is better suited for people with lived experiences. So it is an opportunity to decolonize the system by passing the mic, which can hopefully result in equalization of our relationships between the affected persons, national NGOs, states, and the INGOs. So finally, I want to address the biggest elephant in the room, which is vaccination, the need for vaccination, and the issue of vaccine inequity and how it has affected stateless persons. The difference in power and institutional capacities between the global north and the global south have never been more apparent before the pandemic. Some countries have declared themselves to be free of the virus, whereas many are still witnessing the chaos unfold in even more dangerous ways and still sort of waiting for the worst to happen. The effects of this, especially on stateless persons in a region like Asia Pacific, have been manifold. I mean, take the case of Nepal, where, like Deepti mentioned, undocumented persons have not just faced challenges accessing healthcare, but have also faced issues getting PCR tests done. Many have lost their jobs and their livelihoods as a whole. And even the current vaccination program has largely, excluded the undocumented persons. So vaccines is the only way to address this widening gap between the global south and the global north, the gap between regions, the gap between countries, between the privileged and the marginalized groups within the same country. And when we talk about privilege and marginalization, it is the time also to address the gap between the citizens and the stateless persons. If we dive deep into the root causes of migratory statelessness, it is the widening gap between some countries, the countries with more power and the countries with less power, that results in these, migrations of different kinds, or the threat of persecution, or all kinds of sort of differences in power, access, and control that results in these phenomenon as a whole. So this is an opportunity to sort of decolonize that as well. I'm seeing that I might have a few minutes left, but I still want to sort of address a few questions few issues in the question answer round, and put an end to that. I'll find again sort of repeating the plea to think more about vaccination, repeating to think more about vaccine equity. So thank you very much, Amal and Aisha, again for this opportunity, and thank you so much for listening to me. And just want to sort of highlight the spiel again, which is like, together we can, and together we must.
Thank you so much, Subin, and it's always a joy to listen to you. So our thanks to you. We must learn to unlearn. I mean, that's one of my takeaways from your intervention, and it's so true. It applies to statelessness, but it also applies very much to institutions, and how whatever the institution it is, whether it's a UN agency or an NGO or a government department, that we learn to work in a particular way, and we build our own agenda and our own institutional priorities. And sometimes the biggest barrier to progress is this artificial institutional barrier, which really shouldn't be a barrier, because these institutions have been set up to address these very problems. So indeed, we all need to engage in introspection, to unlearn what we have learned in some ways, and ground our efforts in the insights and experiences and demands of the communities who are stateless, who are affected by statelessness, and who are on the ground fighting to address statelessness. That's a fantastic, Subin's intervention is a fantastic point of departure to talk about the roadmap. Subin already has spoken about the roadmap in great detail. But let me just add another couple of sentences about why we decided to go down the path of developing a roadmap for change and kind of publishing it with the report. And the reason is, and this has been alluded to by Khalid and Deepti and Subin himself, that whilst we feel that COVID-19 definitely has, and we know that COVID-19 has, now that we've done this research and we've documented the experiences of stateless people around the world, we know that COVID-19 has made the situation for stateless people far worse. We also know that the reason this has been allowed to happen, it has been tolerated, in some cases it has actually been encouraged, is because stateless people face a disadvantage, which is often a very artificial disadvantage, grounded on the fact that they don't have documentation in many cases, or if they do have documentation, the documentation serves to prove their lack of a legal status and therefore serves to exclude. And this therefore has been, in a very bureaucratic world, this has been used to justify the denial and exclusion of stateless people. So we're talking about very structural problems which need to be dealt with in a long-term manner, not just for the COVID-19 emergency period, which is very important, but also in the long term. This is an opportunity. A crisis often reveals the true nature of problems. It reveals the true extent of problems, and the COVID-19 crisis has definitely done that for statelessness. And so we saw in this an opportunity to actually work towards longer term change. And this is what the roadmap attempts to do. It is a document which we hope will be looked at by governments and parliamentarians and UN agencies and NGOs and a whole host of stakeholders. And we hope that it's a document which will inspire all stakeholders to look at how they operate, look at how they function, look at how they frame and understand issues, and to question whether they're doing it as best as they can. And if not, whether there are ways in which tweaks and adjustments can be made to ensure that approaches are more inclusive, more based on the experiences of stateless people, etc. But I've spoken for long enough. What I'd like to do now is share a short video compiled by some of our consortium members, which actually talks about the 3 steps of the roadmap and the way in which they feel this has an important role to play in how we deal with statelessness and talk about statelessness going forward.
Hello, my name is Dr. Grant Mitchell, and I'm working with civil society groups in the Asia Pacific to support their advocacy work on statelessness. In a region with the highest number of stateless people already facing entrenched exclusion and inequality, the COVID-19 pandemic has had a further devastating impact on people's rights, health, and well-being. This report, Together We Can, comes at a critical time, highlighting the gravity of the situation facing stateless people globally, but also providing a way forward, a practical roadmap to address both the discrimination and exclusion of stateless people in the face of COVID-19 and beyond. The pandemic has clearly shown that it is in everyone's interest to include everyone, and we encourage all levels of government, UN agencies, and civil society to use this roadmap. A key starting point is to check for institutional blind spots, for all stakeholders to carefully assess and acknowledge and work to understand the contexts that have led to statelessness, the extent and impact of exclusion, and the resources and responses needed to address these. This work must be done together with stateless people to understand their experiences and the solutions that they can share to address the deep structural problems that affect their daily lives. Thank you.
Hi, I am Karina. I am a founding member and currently serving as the Executive Director of United Stateless. We are a national stateless-led organization dedicated to building community among stateless people and allies in order to advocate for our human right to a nationality. I believe in order to end statelessness, we must work together. The second step of the roadmap calls for inclusion, consultation, engagement, and dialogue. This can only happen if stateless communities are centered through consultation, their active participation efforts to address statelessness, and if genuine steps are taken to build trust and extend solidarity towards stateless people. The roadmap advocates for a change in a way that is representative of the diversity of stateless people through our individual stories and experiences. It is also clear ending statelessness is a long game. We cannot end statelessness by ourselves. We need allies and partners.
COVID-19 has shown us that discriminating and excluding individuals and communities from citizenship and other rights weakens our collective capacity to fight global challenges and develop in a fair and sustainable manner. Hi, my name is Ravi. I work towards equality and dignity for marginalized communities and advocate for everyone's inclusion in India. My organization, Development and Justice Initiative, works to address statelessness arising out of the National Register of Citizens in Assam and we are members of the CESF consortium. COVID-19 has starkly exposed the structural factors that increase vulnerability of stateless people. We must reevaluate these factors, including discriminatory laws, policies, practices, and social attitudes to combat intergenerational statelessness. We must be accountable to stateless people and commit to building a just and inclusive societies by focusing our energies correctly. We have to build systems that treat minorities with dignity and enable them to participate in a democratic consultative decision making. This is why we hope all stakeholders will get behind the idea of building back better as set out in our roadmap for change. Thank you.
So there we heard from Ravi Himadri, the director of DAGI, who is also a member of the consortium, Karina, who's the director of United Stateless, and they will be joining the consortium. And of course, Grant Mitchell, who's no stranger to all of us working on stateless and nationality rights, particularly in the Asia-Pacific region. Grant was Subin's predecessor as the executive director of Nationality for All, and he is an expert in advocacy, having previously also led the International Detention Coalition. We're around the halfway mark of our webinar, and I'd like to take this moment to just urge all participants who have any questions for panelists to please use the Q&A function to share your questions with us so that we can take them up in the last 10 to 15 minutes or so of the panel. And now I would like to move on to the next phase of the webinar, which is where we bring in our three expert discussants who will approach this issue from their own perspectives, from the UN perspective, from the perspective of the donor world, and from the human rights and intergovernmental perspective. It's my absolute pleasure to first welcome and introduce Tanya Scienson, who is with UNSCAP. She's a statistician and she leads the initiative Get Everyone in the Picture. Tanya has been working on statistics and on documentation for a number of years. And of course, as you all know, addressing the documentation issue and the registration issue is absolutely crucial to addressing statelessness. So Tanya, I would like to invite you to share some of your reflections on the report as well as the roadmap, but also on what you heard from the panelists who come before you. Particularly, I'd like you to reflect maybe on the importance of civil registration as an essential service and how this has been impacted by COVID-19. Over to you.
Thank you so much, Amal, and also thank you so much for the panelists so far. This has been a very interesting hour so far. So as Amal mentioned, my angle on this whole issue is really coming from the focus on civil registration and vital statistics. Birth registration is really a key to eliminating statelessness. And we are very lucky in Asia Pacific that we have quite strong commitments for universal registration of births and deaths. Back in 2014, we had a ministerial conference where all countries in Asia and the Pacific agreed to work towards universal registration of all births and all deaths. Obviously, we're not there yet, and this is one of the reasons we're here today. I really appreciated the input from the panel members. Of course, the roadmap is also really interesting, also from the UN perspective. The Build Back Better is what we hear a lot, and it's also kind of the UN framing of how we need to respond to the COVID-19 crisis. For civil registration and vital statistics, COVID has really highlighted a lot of the shortfalls with the systems. And as Amal said, one of the things that we have tried to focus on is looking at how has civil registration been affected by the crisis. And one of the problems we've seen is that a lot of countries don't see civil registration as an essential service, which means that those offices were closed early on in the pandemic, which means that we are afraid that even more children will not be registered, which means down the road might face additional problems such as statelessness and other consequences. So we have made a push globally to consider civil registration as an essential service, of course, keeping in mind the protections of staff members in the civil registration offices. We are somewhat afraid that we will have a whole cohort of children not registered during the pandemic, and we will just, so this is something that we have been focusing on. Of course, the COVID pandemic has also highlighted some of the underlying issues with civil registration systems in the region, in particular the issue of death registration and deaths not being registered. We are all aware that the numbers we're seeing of COVID deaths are not the true numbers, not necessarily because governments don't want to publish numbers, but they don't really know the real numbers. When we don't have very tight masked civil registration systems where all deaths and all causes of deaths, including marginalized and hard to reach populations, such as statelessness populations, are included, we won't know those numbers. And we've seen this, right? We've seen sudden outbreaks in certain communities because they weren't monitored and because we didn't realize that there were cases there. So we really need to put even more focus on improving, of course, birth registration, but also death registration and proper causes of death recording. Another point that I picked up from some of these excellent panels discussions was really the topic of civil society engagement. And I think it is really important that we start working more closely together and that we listen more. And I think from civil registration and vital statistics perspective, for a long time, we have had a very top-down approach, thinking, well, if we get politicians and governments to agree on this, eventually it will happen. And maybe eventually it will, but I think it is really important that we also listen to these voices from the ground to really hear what are the implications on people's lives for not having the ability to prove their legal identity. And this has really been highlighted during COVID, right? Hearing these interventions here today, but also, just following the media over the last year, people without legal documentation have struggled even more during this crisis. They're struggling to get vaccines, they're struggling to access healthcare, they're not being included in these social protection measures like cash benefits and these kind of things that are really aiming at supporting the most vulnerable in society. And of course, if we don't have everyone with identity documents, if we don't have everyone with a birth certificate, these are the issues that we see down the line, and these are the vulnerabilities that are just going to impact all of us and going to make all of us more vulnerable when we have communities such as stateless communities that are excluded from these mainstream support measures. So going forward, definitely building back better is what we should all aim for. For me, and I think for SCAP as well, civil registration is really seen as a cornerstone for that. In November this year, we'll have a ministerial conference for the midterm of the Asian and Pacific CRBS decade, getting the governments back in to discuss where we're at. 6 years ago, we agreed on improving civil registration by the statistics. Have we seen those improvements? And next week, we'll be launching a big report. And yes, we have seen improvements, but we are still not close to universal registration. We still have a lot of people are unregistered. And we still need to focus on who are the ones not registered. And we need to make assessments of the ones who are left behind. And here I see the role of civil society engaged with stateless populations as really a key collaborator to make that happen. So I'm really pleased to be here today, and thank you so much for giving me the space to talk about how we're getting everyone in the picture. Thank you.
Thank you so much, Tanya, for your very thoughtful comments, and good luck for the launch next week of your big report. Thank you in particular for drawing our attention to the registration of deaths. This is an issue which is often overlooked, I would say, particularly when we talk about human rights, we tend to talk about the rights of the living. But one of the rights of the living is also the right to be able to grieve for your loved ones. And the impact of not being able to have the death of your relative acknowledged, or not being able to have a proper funeral or mourning process for your loved one is deeply scarring. I remember reading a very touching blog on the European Network on Statelessness's website a number of years ago about challenges of actually burying a stateless person in a European country. This was pre-COVID-19, but COVID-19 has certainly brought that to light. So thank you so much for that, and also for the emphasis on the importance of consulting with civil society. And I will go further and say actually consulting with stateless people and communities themselves, which is very much at the heart of this roadmap. It's now my great pleasure to join our second discussant, Anna Demand. Anna is a foundation manager at the Planet Wheeler Foundation, which supports human rights work in the Asia Pacific region and also in Africa. Anna is also a vice president of Friends for Life and a board member of Inclusive Development International. Anna, you've been hearing our speakers who've come before you, and of course you've seen the report, and we'd be very keen to hear your thoughts and insights. And in particular, if I may pose a question to you, we'd love to hear your thoughts on what the donor community can be doing more, or what it can be doing better to be focusing support to stateless communities in times of COVID-19. The floor is yours, Anna.
Thanks, Amal, and thank you to the consortium for creating this space and this platform, and for elevating these issues so crucial. As we've heard today, you know, this is access to vaccinations in particular is a human rights issue, and not as it is characterized, for instance, in Nepal, a political issue. It's firmly a human rights issue. Thank you for responding to the clarion call of distress, those distress calls that you talked about responding to, and that's the reason the consortium came together. Thanks for responding to those distress calls in the midst of so many. There's been so many areas that we could have focused during this last year, going on to the second year of this crisis. And it's just absolutely imperative that the donor community and the wider community listens to what you're saying here today. In particular, I would say your focus on the importance of centering people with lived experience. That is non-negotiable. We're involved in an alliance in Australia, in the region, to support people with lived experience who are leading their communities and to aspire to act as allies. I would urge everyone who is not coming from a place of lived experience to think how they can be better allies in this space. As for the donor community, Planet Wheeler Foundation is spending down its corpus, so we're no longer taking on new partners. However, we do still play a convening role as a donor, and so I'll certainly be bringing the themes of this, the themes that this collaboration is unpicking. I'll certainly be weaving them into our work. In particular, you know, the really important point that just because there's legal rights are cemented in law, that does not mean necessarily that anything changes for people on the ground. And Khalid, you spoke really eloquently about that. I think, however, it does, if there's legal structures in place, that does give donors something to hook onto. It makes it easier to talk in a really crass way for you to sell whatever proposal that you're trying to pitch your proposals to donors. If you can talk about laws and rights that aren't yet marrying up, that gives you a much a pointier way to talk about, let's face it, getting money for these really important initiatives. the work that we heard about in Nepal, the work that we heard about in Bangladesh, just really important, crucial work, and work that is in the absence of INGO workers. Actually, people with lived experience have always been at the coalface, but now even more so. So yeah, I'd like to thank you for your work, and we'll continue to follow it with interest and do my work within the donor community to disseminate your findings.
Thank you, Anna, for your thoughtful comments and for your solidarity, which you extended to the consortium and to statelessness actors, and for those very practical tips as well. A lot of food for thought there. And I'd like to now turn to our final discussant for this launch webinar, Eric Paulson, another great friend to the statelessness and nationality rights community. Eric is a human rights lawyer. He was formerly the director of Fortified Rights, but the legal director of Fortified Rights, but he is now Malaysia's representative to the ASEAN Intergovernmental Commission on Human Rights, or ICHA as it's commonly known. So Eric is very familiar with human rights, both from a civil society perspective, but also from a governmental perspective, and he's worked on nationality rights issues in a number of countries in the region. So Eric, I'd love to hear your reflections on the report and the panelists that you've heard before. And may I ask you in particular maybe to reflect on the structural discrimination which we all feel underpins statelessness, and how you've seen this play out through your work and your experiences.
Thank you, Amal, and thank you for the very kind introduction. I mean, the issue of right to nationality is one of my, core area of interest. And as Amal, you've said, I've worked on this issue for a long time, and I've also worked in some of the countries which has been highlighted. Of course, Malaysia, in Myanmar, in Nepal, and also in Bangladesh. So I'm quite familiar with some of the common issues that plague the right to nationality. I think one of the most important issue when it comes to trying to frame the whole issue is to identify the actual problem, because a lot of governments, they try to obscure, or at least they pretend that there is no statelessness, there's no issue. You just need to follow the nationality law and everything is there. So I think it's incumbent upon advocates of right to nationality to try to pinpoint exactly these are the problems and these are the individuals and communities affected. Obviously, issues of statelessness that affects the Urdu speakers, Biharis in Bangladesh will be different from statelessness in Nepal, because there's also issues about where they are from, issues of caste, whether they are higher caste or lower caste, etc. And of course, issues of statelessness in Malaysia. There are various categories of how these people become stateless. Some are due to historical inequities. There are migrants from India who have been in Malaysia for generations, but because of after independence, so some of these communities were left behind. They did not register their citizenship, where after independence it was easier to obtain documents, but thereafter lack of documents, and that has perpetuated to the generations years later until today. And then there are some gaps in nationality laws when it comes to discrimination against women, foundlings, and of course this archaic notion that men and women must be married in order for the parties to pass on their citizenship. I also don't think I think we need to narrow down the scope of right to nationality to some of these core areas. And sometimes I feel there is a confusion, and I think it doesn't help when the government and also some human rights advocate to also mix up the issue. For example, Rohingyas in Malaysia. Yes, the Rohingyas in Malaysia, they are stateless, but they are not Malaysian citizens. They are stateless, by virtue of the deprivation of citizenship by the Myanmar government. So there is a mix up of issue, and so that's one example. The other example is undocumented migrants. Yes, it is a concern that undocumented migrants, for example, in Malaysia, they can be subjected to arrest, detention, etc., etc. But this is not a stateless issue. Because undocumented migrants, they come from various countries, from Pakistan, India, Nepal, etc. They have citizenship, so it doesn't help if we obscure the issue, and sometimes governments might use the excuse to just say that why are we talking about all these issues? These people do not have rights to our citizenship. So when we are talking about citizenship, let's try to narrow it down to those with a genuine, effective link to the country. These people who have, most of them who are born and raised in Malaysia all their lives, they have and they have a right to claim to Malaysian citizenship. So I think it's really important to do that, because a lot of governments, like the Malaysian government, the government ministry that holds on to this citizenship privilege, to them is a privilege, it's not a right. This is the Home Ministry, and home ministries all over the world, they are extremely conservative, and they will use all sorts of excuses to try to deprive you of citizenship. Of course, if your background, your parents, they're all fully documented, then there's no issue. But if any of these issues arises, you do not have a birth certificate, you come from a marginalized community, you are seen as the other, then this bureaucracy will just grind you down. And Malaysia, I suppose, is the same as many of these countries who have issues of statelessness. You have very, very little recourse. You can try to go to the courts. There is a constitution in Malaysia, like in many other countries. There's a framework of citizenship rights, and then there's a framework of citizenship laws. But nonetheless, look, it is not possible to challenge every single case. So what we must do, I feel, is to pinpoint the problem and to advocate the issue correctly. I think it would be quite useful to look at how some countries have changed their perspective in terms of, let's try to resolve this issue. And I think across Asia Pacific, there have been some improvements in Indonesia, for example, in Cambodia, in Thailand, and other countries. Let's try to pinpoint some positive policy changes. How have they been convinced that this is the way forward, rather than to perpetuate a cycle of statelessness? Thank you.
Thank you so much, Eric, for, as ever, your insightful comments, and thank you for pointing out the fact that sometimes statelessness is confused with migration, it's confused with refugees, and of course there are huge overlaps. You can be a stateless refugee, as a Rohingya often would be. You can be a stateless migrant, but one doesn't necessarily mean the other. Thanks also for pointing out the importance of being strategic about how you frame your advocacy, and who you kind of promote to push for the right to nationality, and who you promote to push for protection as stateless people. But of course, in this context, a Rohingya refugee in Malaysia deserves protection as a stateless person and as a refugee, but their child born in Malaysia, then there may be a question there about their right to nationality as well, if they don't have access to another nationality. Thank you also for all of your other comments about the good practices that we have seen, and this is indeed important. We probably haven't spent as much time on good practices as we should have in this webinar, but the report does draw out some really important good practices, not least in Malaysia, where after some very extensive advocacy from Malaysian organizations, there has been a shift in immigration policy, which has allowed for the unification or the reunification of families who have been split across borders as a result of COVID-19. And their problem emerged from the fact that due to Malaysia's gender discriminatory nationality laws, foreign spouses, for example, couldn't access Malaysian citizenship, or children born abroad couldn't access Malaysian citizenship. And therefore they were denied entry or re-entry into Malaysia when the borders were closed due to the pandemic. But this situation has been largely resolved due to some very targeted advocacy. We're now going to move into our final Q&A session. We have about 20 minutes or so for this, along with concluding comments. And we have a few questions coming in. But before I turn to the written questions that have come in, I would like to hand the floor to Pasu Sharma-Luital, who is a formerly stateless refugee, who is now an Australian citizen and very active, a very active advocate in Australia. And actually, he's a living embodiment of the importance to consult with people who have lived experience, because Pasu has used his lived experience in a very positive way to help shape Australia's policy on vaccinations. It's a fantastic story, which is also featured in the report. So Pasu, we'd love to hear more about your experience in this regard.
Thank you, Amal. Thank you so much, everyone. I would just like to say first a little bit about myself. My name is Pasu Sharma-Luital, formerly stateless refugee from Bhutan, now Australian citizen. Thank you, ISI, for the opportunity to speak here at the Asia Pacific launch of the report. Together we can, the COVID-19 impact on stateless people and roadmap for change. As a team member of interim core group of the Global Stateless movement and the General Secretary of the Refugee Community Association of Australia, an independent refugee-led peak national advocacy organization providing unified voice in Australia, I would like to share the light on some of the positive work we have done during COVID-19. Our COVID-19 work started when Australia in Melbourne went in first lockdown in April 2020. Rohingya community leaders have approached us to provide basic food items to support Rohingya asylum seekers' families during the holy month of Ramadan. The asylum seekers were struggling to provide basic food for their families during the fasting and were not eligible to receive any government or other support during the COVID-19 crisis. Most of them have their refugee status rejected and didn't have a bridging visa, so therefore they cannot come out of their home for being arrested. Accordingly, RACA, that board, decided to personally contribute and provided the relief to 40 Rohingya families. At that point in time, we didn't have 1 cent in our account. Following this relief, RACA approached the wider Australian society to donate food. And I wanted to read out 2 quotes of Rohingya refugee women who when they received the relief, they said, Miss Hazara, a Rohingya asylum seeker, said, quote, I will do 1,000 dua, pray 1,000 times for Raka for coming to my door with food when I don't have enough to feed my family in the most important religious time in my faith. I will use all this food to break our Ramadan fast as long as it lasts, unquote. Another Rohingya asylum seeker, Ms. Began, said, quote, until today, no one has provided food like this to my family. We have no support from the government or Centrelink. This food will mean a lot to us. Thank you, Raka and Rohingya leader, unquote. And within a month, Raka received a food donation, and in 8 months, we have delivered 14.7 ton of food and over 30,000 reusable masks across Melbourne. Majority of the food was donated and sourced from the Vietnamese community members who arrived in Australia as refugees in early 1980s. As all places were closed and permissions were not granted to use community centers due to the strict restrictions and logistics, I have decided to use backyard of my home as a food distribution center for almost 1 year. And I would like to quickly share a small story. Raka had been approached by a doctor that his patient, a recently arrived refugee family from Iraq, is in need to desperate food assistance. The family have 10-year-old daughter, Christina Obada, who was captured by ISIS for 3 years, with a blind father, 75 years old, and mother, disabled, 55 years old, with 2 siblings. We have been able to help this family and many in similar situations in Australia. As a RACA member, I have been able to approach the Australian government agencies through a number of national roundtable meetings to reach out the plight of refugees and temporary visa holders and its impact to vaccine hesitancy due to fear of deportation and arrest. And the Australian government have agreed that vaccine will be provided free of cost to everyone in Australia, irrespective of their visa status, and data from the health department will be kept safe and secure and will not be provided to anyone, including the Department of Home Affairs. And for the other reason, I also work for vaccine rollout in the Victorian government as a senior stakeholder engagement officer, where I would get opportunity to have my say to influence and lobby the changes. And following our successful, I'm done. Successfully food delivery lockdown, RACA have been funded 100,000 last year and 109,000 this year to continue the progress work. Victorian government have recognized us through providing refugee category award. So what lessons we have learned, finished, that refugee communities show that they are more prepared to take risks and challenges to help refugees at the time of need. Thank you so much.
Thank you, Pasu, and thank you for squeezing so much into a very short period of time. But also for, I think, the important message of highlighting that because of your lived experience, as well as because of your community engagement, you were aware of the issues that stateless and other asylum-seeking migrant communities in Australia face, and you were able to therefore use this experience and influence policy change in Australia. And that shows the real importance of making decisions, policy decisions, which are grounded in the lived experience of community members. Let's turn over now to our Q&A and to our closing comments from our panelists. And I first have a question, which I think is probably best answered by Tanya. And this is a question from Ravi Himadri, who says, thanks to Tanya and Amal on registration of deaths. That's very important. Similarly, birth registrations have also been hampered during the pandemic. Our systems are already lax on birth registrations and birth certificates that are so crucial to prove citizenship. Children born during the pandemic joins millions of other children without proof of birth. On birth registrations, what would our strategy to build back better be? Grateful for any ideas. And Ravi is speaking from India.
Thank you so much, and thank you for that question, Ravi. I very much agree that the lack of birth registration is not, unfortunately, just a COVID problem. It's much broader than that. So in Asia and the Pacific, as I mentioned, we do have agreements from governments to work towards universal registration, but a lot of governments are really struggling with that. Civil registration systems have traditionally been underfunded and not getting enough support. There's a lot of outdated systems and a lot of non-complete systems in Asia and the Pacific. So there's a lot of things that needs to be done. One of them is about awareness raising. People need to understand the necessity of registration, but they also need to have easier access to registration. If you have to go back to the registration office 4, 5, 6 times to sort out your birth registration of your newborn child, it's very unlikely to happen. We need to have closer collaboration with health services so that notifications and so on are done by the health service. Also so that parents are encouraged by health services to ensure that the children are registered. There's a lot of legislative changes that needs to be made, and I think that relates very closely to what Pasu was talking about as well, and also on panelists as well. Some legislation on civil registration is extremely outdated. And there's just processes that are not working very well. As I mentioned, if family have to come back many times, or if papers have to be shuffled from one office to another, and all these kind of things. So there's a lot of underlying problems with the civil registration system, and the COVID has obviously made that even worse. And we are afraid that we'll experience another cohort of children that are not registered. But what I would want to say is that a specific thing that we are hoping that countries will do in response to COVID and birth registration is to make it easier for families to register late births. So one of the things we know is that many countries will impose fines and so on for late registrations. And technically that is to encourage families to register very quickly after the birth, but that has obviously not always been the case, and definitely not from COVID. A lot of registrations have been delayed. So one of the global guidelines is to be a bit more lenient and allow late registrations without penalizing the families because they have had increased difficulties of registration. So, again, I could talk a lot about this, but we are pulling together all the governments of Asia Pacific in November 2014, and it is really to try push this issue forward and try and make sure that we get even stronger commitments to improve civil registration and vital statistics in all of Asia Pacific. So thank you very much for that question.
Thank you, Tanya, for that very thoughtful answer. And we have another question in from Pritisha Shrestha. And maybe I will ask Eric as well as Anna, if you wish to comment on this question, and then we can do a final round with the three main panelists. So Pritisha's question is as follows: this pandemic has unmasked a different layer of discrimination faced by stateless people. The right to vaccine is denied to the people without citizenship. This is a pressing matter to focus on. Similarly, the right to citizenship is connected to other rights, which is well pointed out by the panelists here today. My question is on the right to food for stateless people. How can advocates of the right to citizenship address the right to food and food justice for stateless people?
Thank you, Amal. Well, in a country like Malaysia, where everything else, in order for you to access anything, you need to have the identity document. So it might not be the same in other countries, but in Malaysia, it's quite essential. By the age of 12, you gotta have a my card for children, and then at the age of 18, then you gotta get someone as an adult. So from getting a mobile phone to opening a bank account, and certainly in order for you to get yourself vaccinated, Malaysia is trying to do it through the high-tech way. So you gotta register, you gotta have an app. You got to key in your ID number, and then from there you can get a appointment to be vaccinated. So if you're undocumented, then you would have difficulties assessing these tools in order to access government services. But having said that, Malaysia, like many other countries in the region, there's also a gap between those who have access to this technology and others, the older generation, people from the rural community, and indigenous people. So the government does recognize that, and I think the Ministry of Health understands it better than the Home Ministry. So the Ministry of Health is taking an approach of a humanitarian approach. You're gonna get herd immunity, you've got to vaccinate as many people as possible. So it is possible to approach individual clinics, individual mobile vaccination center, and get yourself vaccinated, even though technically you are not registered. But it is not uniform. It is a matter of discretion of the person in charge of that particular center. So again, this is not right, because this is now out of how well you're connected, or somebody brings you, and a member of parliament brings you. So it is not right, but that's the situation in Malaysia. So regarding the right to food, again, assistance is normally given if you are registered, if you're a person who is with disability, or if you're under the government's scheme. So it is very tough. So if you're a stateless person, and if you are the really, really poor community who needs support, then you basically falls outside of the net. So the way forward, again, it is really tough, but in Malaysia, I'm happy to say that more and more stateless communities and people are speaking up. So hopefully this issue can be addressed sooner rather than later. Thank you.
Thank you, Eric. Anna, would you like to add to
that? So on the issue of food security and vaccine equity, from a donor perspective, it's about making sure that you're speaking to the right people. You're speaking and connecting with people, again, with lived experience, or people who are allies of people with lived experience and genuine allies. An ally, of course, is someone who people with lived experience has named as such. So you can't really appoint yourself an ally. You have to earn that trust. It's true to say. Yeah, in terms of the food security, it's about finding the right partners, and as a donor, it's about finding the right partners and making sure it's absolutely participatory, bottom-up development. It's the only approach that's sustainable.
Thank you so much, Anna and Eric. And I mean, your two interventions, I think they encapsulate the messages that we've been returning to over and over again, both in the report as well as in this pandemic. Firstly, it's the absolute necessity, not even importance, but absolute necessity of consulting affected communities, allies of those communities, and grounding your approach on their perspective. And secondly, going to Eric's point, the arbitrariness of documentation, which should serve to facilitate access to rights, but which instead, as we've seen in the context of COVID-19, has turned around on its head, and the lack of documentation is actually a barrier to accessing rights. And I think we need here, if to use Subin's phrase, unlearn what we've learned, we need to learn that documentation should be a facilitator, but it shouldn't be a barrier. And the primary consideration has to be, from a public health point of view, from a human rights point of view, access to vaccinations, access to food, etc. And if the lack of documentation comes up in this context, then we can treat that as an opportunity to resolve the lack of documentation rather than as a reason to deny access to crucial rights. I'm now going to ask our three panelists, Subin, Deepthi, and Khalid, to come in with their concluding comments. And what I would like to do is put another question that I've come to us, to the three of you. And I would like you to reflect on this question in making your concluding comments. Though please do bear in mind we're now almost at our full time, so I'd like you to restrict your comments to a minute or so each. And this is the question. Two of the panelists spoke about how a law on paper is often different to how a law is applied in practice. And this highlights how issues and impacts on stateless people continue even when law and policy changes happen. One of the most important things is to listen to stateless people and to take a lead from them. What are some practical, concrete steps that different actors can take to ensure that stateless people are actively included and centered in responses? So that's a question that we've received, and I'd like to ask our panelists to reflect on that in making our concluding observations. And let me do this in reverse order, starting with Subin.
Thank you very much, Amal. And I think this sort of gives me the opportunity to sort of summarize everything that I've said as well, the question in particular, because NFA is in a stage where we are doing a lot of reflection and introspection in terms of our approach and the principles we apply to move the organization forward. And one of the things that we've been trying to focus on, or we've been trying to emphasize, is the importance to listen more and to make the persons with lived experiences feel heard. And this might mean that organizations like NFA will be invisible, or the strategy would be for us to be invisible, to stay invisible, and make sure that we create more spaces for people with lived experiences to share their own stories themselves. And not just in terms of sharing the stories to sort of make others aware, but also participate meaningfully in the discussions on decision-making, the discussions on strategizing in terms of addressing statelessness. And this is not just in terms of the national framework, but also in the regional and the global framework as well. So creating those kinds of spaces where persons with lived experience can participate, can share their own stories, can also sort of talk about what the next steps should be. So I think this is one way of amplifying those voices, one way of making sure that we do not occupy those kinds of spaces. And just to also sort of reflect on the entire discussion that has happened, I again want to emphasize the importance of vaccine equity. And because unless there's more vaccine in these countries, there won't be, stateless persons will always be in the margin. Once there's more vaccine, there's more sort of proper channel, there's proper access, then there's more people getting the vaccine, and which would allow stateless persons also to get the vaccine. Because as we have seen in this report, the gap between the stateless persons and the non-stateless persons, all the citizens, has been increasing. And the pandemic is going to create these long-term changes that will make it very difficult for stateless persons to come back up. and it will sort of, destroy the livelihoods for generations maybe. So I guess that is the other issue that I would want to request the international community, by everyone present here, to keep emphasizing, to keep talking about the discourse on vaccine equity. Thank you very much, Amal.
Thank you so much, Subin, and for so clearly articulating the urgency of the situation. Deepthi, over to you.
Thank you, Amalji, once again. As I was listening to all the conversations here, like, regarding the concern about vaccine and then the food and stuff like that, it amazes me, like when any country or government says, like, without a citizenship or some kind of documentation, you are not allowed to get any vaccination. Excuse me, people with or without citizenship, like, the COVID doesn't say, like, okay, if you have citizenship card or if you have documentation, I'm not going to be, contracted to you or something like that. So if any single person as a stateless person is also like left out from a vaccination program, that could be very directly, it's a risk to the people with the documentation or the entire nation as well. It's a simple thing that people are not realizing. That is not a question of upkeeping with the ego of having whether you have a documentation or not. It's about safekeeping. Similarly, let's compare that to the state of statelessness. Even this, one stateless person can in future, the possibility of multiplying the stateless people are even more, you know so until and unless this should be resolved from that point of view, as a humanitarian point of view, as a human point of view, like, getting a vaccine to getting a documentation done. So I think we can also maybe somehow, I don't know how creative we can be or how effective we can be on this matter in highlighting this pandemic as a stateless, like how can we compare this state of statelessness with the pandemic itself? So maybe it can be more effective in future as well. This is from my side. Thank you.
Thank you so much, Deepthi. And Khalid, any concluding thoughts from you?
Thank you, Amal. I think in the end, I can must say the COVID is not just identifying the citizen, it's affecting all the community people, those are citizen or non-citizen. So now the time is realize really we all human beings are in problem. So we have to come over with all. Not we are not going to exclude any community like Rohingya or Bihari or any other people, because vaccine is a human rights issue and the food relief is a human rights issue. So while we are distributing the food or providing the vaccine just for the citizen, this is, I think, not a good idea. So in that case, I think more and more consultancy and advocacy is more important to raise the voice for the marginalized community, because it's their rights. Even raising voice, the rights of the marginalized people, those are in the mainstream, those are in the position. Thank you.
Thank you so much, Khalid. And both you and Deepthi have pointed out that vaccinations is a human rights issue, and it's also a public health issue. From public health point of view, as is often said, no one is safe until everyone is safe. And from a human rights point of view, everyone has the right to adequate healthcare. All that's left for me to do is to do a quick round of thank yous. Thank you first and foremost to our wonderful panelists and discussants for sharing your time and your expertise and your thoughtful comments with us. This has been a very rich discussion because of you, and we're very grateful to you. Thank you also to our fantastic partners, Nationality for All, for co-sponsoring this webinar. In particular to Hannah, who's done so much fantastic work behind the scenes, and of course Subin, who's spoken so eloquently today. If you haven't followed Nationality for All, please give them a follow. They're a fantastic organization who really embody a lot of the approaches that we've spoken about in this webinar in terms of consultation, partnership, solidarity, and they deserve to grow from strength to strength. My thanks to our COVID-19 Consortium members, a number of whom have dialed into the webinar, for your incredible work over the last year and a bit, for being at the forefront of the pandemic, for being at the forefront of your communities, and being that point of intersection and the interlocutors between your communities and authorities, and for doing so often at great risk. A number of you have also, as human rights defenders, been at risk, and you have still worked through that, and it's so important to support all of you. My massive thanks to the ISI team for their contributions to actually getting the report done and over the line, and then for making it also look as nice as it does. Otlin, Georgia, Vera, and Elena in particular, and also, of course, Laura, who's my fellow co-director. Thanks to Grant Mitchell, who's come in as an advisor to the consortium and helped us with some of our advocacy. And my thank you to the audience for listening in, and hopefully for taking action on a number of the things that we have discussed, that are raised in the roadmap, that are raised in the report, and which demand our action, because the situation that a number of stateless people are facing is a situation that no one should be facing, certainly not in the 21st century. As the report says, together we can and together we must come together to address the structural discrimination that underlines statelessness, both to respond to the emergency needs of COVID-19 and to respond to the much longer term human rights challenges and issues that stateless communities face. So thank you again for joining us, and I wish you all a wonderful week and year ahead. And do stay in touch with us, with the consortium, with Nationality for All, and we are very open and willing to collaborate to, in any way possible, to kind of get the roadmap moving. So if anyone wants to reach out to us, please do so. Thank you again, and goodbye.